आगे बढ़ते हैं। कोरोना संकट के बीच मुंबई में पीडियाट्रिक inflammatory multisystem सिंड्रोम के मामले सामने आए हैं। हाल ही में बच्चों के बीच इस बीमारी के लगातार बढ़ने की खबर है। कोरोना के साइड इफेक्ट्स से होने वाली इस बीमारी के मुंबई के अस्पतालों में जुलाई के अंत तक केवल 36 मामले थे, लेकिन अक्टूबर के आखिर तक शहर के कई प्रोमिनेंट अस्पतालों में इसके 140 से भी ज्यादा मामले अब सामने आ गए हैं। कोरोना के ठीक होने के बाद तेज बुखार, रैशेस और सांस लेने में दिक्कत होना P.I.M.S के लक्षण बताए गए हैं। हालांकि P.I.M.S से होने वाली मौतों का आंकड़ा 2% के आसपास है।
Seen in adolescents, early adolescents. Now these are the patients who actually either would have had history of fever in the past few days, which could have been a COVID infection, and then later on after a week or so may have symptoms that are suggestive of PIMS. The symptoms that we need to look out for are a current episode of fever or a previous episode, or you may have rash on the body. You could also have vomiting, diarrhea and abdominal pain, which are one of the prominent symptoms. And you could also have things like bloodshot eyes. These are the patients who can come in a stable state, and if we can suspect this in the early stage, we could do COVID-19 antibodies in these patients at the same time, or we could also do an RT-PCR, because there could be a current infection, but it's more likely to be an immune mediated, so there might be a lag from a current episode of COVID-19.
That study was from 1st of May to middle of July, and we were 4 hospitals, corporate hospitals within the city of Mumbai, and we looked at 23 patients who were the first patients of PIMS reported in the city. And from that, what we saw is that the children who required hospital admission and ICU admission, they tended to get very sick. Some of them had cardiac dysfunction, which meant that the heart muscle became weak, and some of them had dilation of their coronary arteries. The coronary arteries are the vessels which supply blood to the heart itself. But the good news is that with timely diagnosis and treatment, they had an excellent recovery. And most of them were completely recovered by the time they were ready for discharge, and we had only one mortality in that whole study group, which came to about 96% survival. So that was the very early cohort, and our results have been as good, if not better, since then. So generally speaking, if we diagnose this in time, they do very well.
By July, the major hospitals in the city recorded around 36 cases of PIMS, but now the numbers are much higher. Now the major hospitals in the city have recorded more than 140 cases. Talking about PIMS, as per the experts, more studies are required to understand and to see whether or not PIMS itself can have long-term effect on children, and whether or not any of those effects can be fatal in any way. Talking about the numbers, they are rising. More than 140 cases recorded by major hospitals in the city till October end.